In this video, I'm going to give you an overview of what we're trying to accomplish with the rotator cuff repair and how to do that safely and most effectively. To begin with, it's important to understand what the rotator cuff is. The rotator cuff is a series of muscles that connect the ball and socket in the shoulder, and they work together to keep the ball centered in the socket. The rotator cuff itself is the tendon that attaches the muscle to the bone. And that tissue is susceptible to degeneration for a variety of reasons. It takes a lot of load, it is subjected to friction, and the blood supply is not very good. So it doesn't have the greatest tendency to heal. So with a rotator cuff repair, there's a variety of ways to do it, but ultimately we try to sew the tissue down to the bone. Typically that involves an arthroscopic procedure with little poke holes. We rough up the bone, rough up the tendon, and compress those two surfaces together. That mechanically reattaches the tissue, but unless it biologically heals, it's not going to be particularly functional. In addition to biologically healing together, we also need to restore function. And so fundamentally, rotator cuff rehabilitation involves balancing healing and protecting the rotator cuff versus getting stiff and ending up with poor function. And really, to have a perfectly rehabilitated shoulder, we need to balance those two aspects perfectly. Now let's talk a little bit about what active range of motion is and what passive range of motion is. We normally actively move our joints. That means when we want to reach for something, muscles fire and our arm moves. That's active range of motion, that's normal. If you pretend for a moment that the arm is paralyzed and can't move, but the joint is supple, and then some outside force acts on it. That could be your other arm raising it up. That could be a pulley that raises it up. It could be a physical therapist helping to move your arm around. And during that entire time, if your muscles are relaxed and you just allow it to passively move, that is passive range of motion. Very different from active range of motion. And the reason this is very important is that when somebody is passively moving, the muscles that are involved with that motion can theoretically be relaxed. And that means we can get you moving after a rotator cuff repair without putting stress on that repair. And so I break rotator cuff rehabilitation down into 4 phases. The first phase goes for about 2 weeks after surgery. From the date of surgery to the first follow-up visit, around 2 weeks' time. It's really the important time to protect the healing rotator cuff. And the patient is in a sling, and we want them to do as little with their shoulder as they possibly can. Just allowing it to be in the sling and perhaps working on finger range of motion, wrist range of motion, and elbow range of motion. Obviously, patients will want to get dressed and take a shower, and it's important that when they do that, they do it with passive motion of their shoulder only and without actively moving their shoulder. Phase 2 then goes from weeks 3 to 8 after surgery. And that involves intentional daily stretching exercises, passive only. And that passive motion is helping to avoid stiffness, but not putting unacceptable stress on the repair. Once we get past 8 weeks, I transition my patients into a month of active range of motion before strengthening. And active range of motion is what we typically do every day. That's where you move your shoulder with its own muscles. And obviously helping it a little bit during this time is appropriate, but we at that point are out of the sling and we're doing exercise intentionally to get the muscles to fire a little bit, which then brings us to week 12, which is 3 months from surgery, and strengthening begins. We begin using little rubber bands, light weights, and that process can go on for several months' time. So that's the overview.